Good evening. My name is Anthony Patton, and I will be presenting on the Diagnostic Assessment. The Diagnostic Assessment is a highly specialized procedure concerned with the persistent or recurring learning difficulties. Now, there are other alternative methods of instructions that can be used, but a diagnostic assessment is used when a student continues to experience failure in reading, math, or other subjects. So pretty much the diagnostic assessment searches for the underlying causing of those problems that do not respond to the formative assessment. So therefore, that makes the diagnostic assessment much more comprehensive and detailed than the formative assessment. And the aim of the diagnostic assessment is to determine the causes of persistent learning problems and to formulate a plan for remedial action. The diagnostic assessment also involves the use of specifically prepared diagnoses as well as various observational techniques. Even some of the serious learning disabilities are also likely given the appropriate diagnosis and the development of an IEP or an individualized educational plan for the student. The more serious learning disabilities are likely to require an educational specialist, a psychological specialist, or a medical specialist. Now, the usage of the diagnostic assessment. We use the diagnostic assessment to diagnose the strength and areas of needs in all students. The Indiana Department of Education uses the acuity test. The purpose of the acuity is to provide a diagnostic measure for students in grades 3 through 8 in English language arts, mathematics, science, and social studies. And here's a snapshot of the acuity assessment program in the state of Indiana. There are 290 plus Indiana school corporations, 1,400 plus schools, more than 500,000 students, and more than 40,000 educators and staff. Now, the challenges and negative effect of the diagnostic assessment. One of the first challenges is the one-size-fits-all approach. Many schools and districts have created the RTI systems or response to intervention systems that move straight from screening to instruction without looking more closely at the individual student. And this problem is enlarged when the school adapts a one-size-fits-all approach. And without very good diagnostic information, our instructional programs and students' performance will not improve. And RTI will be a simple or alternate route to special education placement. Also, the understanding of the diagnostic data and incorrect instruction. Consequences and outcomes of the diagnostic assessment. One of the outcomes of the diagnostic assessment is that it allows a specialized plan for rectifying the specific needs of the students. So it targets the areas of weakness, and teachers are able to focus on the specific needs of the students. The diagnostic test also shows the growth of students throughout the course of a semester or a school year. Another outcome of the diagnostic assessment is that it is a learning outcome. Learning is improved because of the lens it is for a teacher that guides instruction. It is the map that tells a teacher where students are and what direction instruction needs to go. Consequences. If interpreted wrong, the specialized instruction can be harmful to the student. For example, if a teacher looks at diagnostic assessment and interprets it wrong, and the student does not need the specialized instruction that then teacher gives, or the teacher does not give the correct instruction to the student can be discouraged, and it can be harmful to student learning. That is the end. Thank you.